Covering your health tonight, people with diabetes are finally getting a break on insulin. 3 major insulin manufacturers are now offering a $35 cap on prices for many patients.
News 15's medical editor, Dr. John Lepre, breaks down the impact of the much-needed relief.
We talk about the high price of medicine, and insulin is a prime example. But soon, this price should be better for everyone. Insulin is a life-saving medication, essential for management of both type 1 and 2 diabetes. Unfortunately, 1 in 4 cannot afford to take their medication as prescribed. The price of insulin has risen sharply over the last 20 years. When I started practice, a vial of insulin cost $19. Now this cost is $275. However, adjusting for inflation, that $19 vial should only be $35 today. Furthermore, today that vial only costs $6.80 to produce. So how did it get this way? 3 companies control 95% of the insulin market. There's been very little incentive for price control until now. Without insurance, a long-acting insulin will run about $480. Add a short-acting insulin for meal coverage, and that's $180, for a total of $660. Sadly, many without insurance simply cannot afford this. They either cut way back or skip their insulin altogether. This is dangerous. Insured patients have it a little better. Last year, Medicare negotiated an out-of-pocket cap of $35 per prescription. Commercial insurance soon followed, limiting copays to $35. Now this takes us to Medicaid, and here the story takes an interesting turn. They require drug companies to rebate the difference between the retail price and the price adjusted for inflation. So using our simplified example, they're rebating more than the actual profit and losing money. So their solution? Lower the retail price to decrease the rebate. In fact, all 3 major drug companies just announced they're lowering the price of insulin about 70% across the board. So the cash price of our regimen will be a little more manageable at $165 per month, while everyone else remains capped around $35. And this should come as some relief to those bearing the high cost of this life-saving medication. Wishing you better health, Dr. John Lepre, News 15.